I have slightly digressed from the topic. It's about cancer awareness, and try to finish on time also. So we all know in community and in practice everywhere that everybody is at risk to develop cancer. There is nobody how so high flown or big guy or a small guy. So you could see that in US 1 in 4 people will land up with cancer. That's huge. That's a huge number of problems. Knowing that as the problem itself is enough to raise horror kind of a thing. It is becoming the leading cause of death. The leading cause of death at this point of time is cardiovascular. But way the people are getting cancer and the way the people are dying from cancer, I think it's going to become the #1 cause of death. So it's a very big problem which needs to be addressed. Everybody knows that the fact is that early detection is the key. People who are picked up in early stage, which in our nomenclature is like stage 1 or stage 2 disease, is something which leads to cure in a large majority of population. But the problem is there that we don't pick them up. Small number of people could have hereditary carcinoma. Now this was kind of popularized by Angelina Jolie, who talked about hereditary cancer as she was carrying those genes which could have made her get a breast carcinoma or ovarian carcinoma. What is a cancer? It is a growth of a normal cells in a very disorderly way. So they have forgotten how they are supposed to remain, which could be initially benign and some of them turn into malignant, or you could have a malignant or a cancerous transformation right from the beginning. The property of the cancer, it spreads very easily everywhere. So as I said, the cancer incidence, because there is increasing population, there is increasing aging population, and on an average, cancer is a disease of an elderly population. That does not mean that the kids and the youngs and the adolescents cannot get cancer, but largely speaking, it is a disease which happens in 50s, 60s, and 70s, and now that you have aging population, so you have a huge number of population which is eligible in the context of age, as everybody is talking about urbanization, industrialization, occupational exposures, McDonald's diet, and then increased tobacco consumption, as we are all aware of one way or the other. Despite best of the effort, it seems that the tobacco consumption cannot be decreased, and there seems to be a large lobby opposing any kind of advertisorial activities showing the horrors of tobacco. Anyway, these are many of these causes which result in overall increase in incidence of cancer, which is quite horrendous. We are all aware of the fact that the commonest cancer that a male would get is lung, mouth and throat and colorectal, and as you could see that the first two topics are largely smoking or tobacco related. So you could see that if one could get away with a smoking or a tobacco, then approximately it is anticipated that 50 to 60% of cancers can be avoided, which is a huge thing, but has a political hue to it. In females, breast, cervix, which has become second common after a lot of pap smears and to a certain degree in our country of vaccination. But these are the common problems that we get. Even the females have a practice of tobacco chewing or even supari chewing, which leads to tongue carcinoma, and it is not uncommon in rural population. As I said, pick it up early. If you pick it up early, then maybe 70, maybe 60, maybe 80% patients will land up with cure. But most of our patients actually present at advanced stage. Is it ignorance? Is it fear of getting investigation? Or is it lack of education? Or also there is a belief, which is completely wrong, that the biopsy leads to cancer spread, which is a completely wrong myth. And that is also creating a lot of trouble in our practice. Patients come with clinically largely obvious malignancy and they don't like malignancy, and as you can see, it can kill anybody. If it can kill her, which is Nancy Reagan, wife to famous president of USA, then it can kill anybody. So as I was talking about cancer risk factors, you could see tobacco, and as is pertinent to the topic today, even the environmental pollutants of one kind or the other. And these all plethora of causes are there, as Dr. Kapil sir was talking about. They are the cancer risk factor. But I think tobacco use is the huge and the biggest problem of our country and the countries around us. So Bhutan has a very high incidence of tobacco chewing. They have their own name to it. Even young girls like 10 years or 12 years chew a lot of tobacco and the betel nut in Bhutan. Problem with the symptoms and sign of cancer is that in the early stages patients do not have symptoms. For example, let's say ovarian carcinoma, it would manifest with some amount of bloating and some tummy pain, and you will not start talking about a cancer if somebody has a tummy upset. I'm sure everybody among this audience would have had n number of tummy upset, but we don't start thinking of malignancy. That is where the problem is, that the sign and the symptoms of an early stage of cancer is very subtle. Therefore, any subtle sign which continues for a longer period of time should be thought of to be investigated, not necessarily that you should start thinking of that I have got cancer or somebody has got cancer, but a continued subtle sign, let's say continued cough, should not always be thought of as bronchitis or just tuberculosis, but even that could be maybe in the appropriate setting of a heavy smoker. So a few things about breast cancer. It's a very common cancer in women. This is actually a data coming from US of 1 in 25 or 128, but in urban areas of Delhi, we have almost reached there. So you could see that about 1 in 25 females are expected to develop breast cancer. That's a huge number of cancer. And the ladies, if they are aware of the fact that any lump in the breast should not be ignored, particularly if you have a very strong family history, I think it will go a long way in preventing that. Head and neck cancer. So this is where the problem is, and this is where the horrendous pictures are. And these are the kind of horrendous picture one wants to put on the tobacco thing, which is now getting opposed by at least one high court. That there should not be such pictures and it should occupy less than 40%. Supreme Court is in mess, so can't possibly take care of it currently. But they present with persistent ulcer, maybe with ill-fitting dentures, difficulty in breathing if the disease is hair, patient can complain of hoarseness, change of voice, and some glands in the neck. So gastrointestinal cancer, if the disease is hair, one may find difficulty in eating, one may vomit blood, go down, you may have abdominal pain, persistent loss of weight, which is unexplained, and these are the symptoms which one should be worried about, or a rectal bleed or a bleed anywhere, and one should think of it. Lung cancer is common. These are the common brands of cigarettes, and mostly happening in chronic smoker. Persistent cough, which happens in smoker because smokers tend to have COPD. So persistent cough and breathing difficulty is a common problem in COPD, which is also a common problem in cancer. And unfortunately, tuberculosis remains another problem which is very common. One of the biggest problems that we face with our diagnosis of lung cancer is that a lot of patients get anti-tubercular treatment. I think it is important to understand that not all opacities and not all cough in the lung arising from lung is because of tuberculosis, and we lose many patients for inappropriate use of anti-tubercular treatment. Prostate cancer is picking up because our age is becoming like 70s and 80s, and this is the disease of 60s and 70s and 80s, and it is actually becoming one of the most common cancer, very difficult to diagnose because obstructive urinary symptom is so very common. Almost everybody at the age of 65 or 70 is expected to have urinary obstructive symptoms, so it's a very difficult thing. But if somebody follows a serum PSA, which is a blood test, and if one agrees to it, then one could actually pick up the disease early. These are the X-ray manifestation. So there are so many things that one could utilize to pick up a cancer early. For a female, at least at the age of 50 or beyond 50, one can think of mammogram, which is a sensitive X-ray of the breast. One can use an ultrasonography, which is kind of a very common and easily available and easy tool. CTs and MRI scans can also be used, and there is a new tool, not really new, but a PET CT or a PET MRI, which can actually add on to the value of the CT scan. The treatment of the cancer has now actually moved on a lot. It has become not a very nihilistic way of treating the patient, when the thought was that almost all the cancer patients will die, but I think a large proportion of patients are now actually surviving, utilizing surgery, chemotherapy, radiation therapy, and many other ways we are starting to treat, and the algorithm is actually increasing further. So it's a combination of multiple field specialities like surgical oncology, radiation oncology, medical oncology. It's a combined approach, and including the lab, that the treatment has become much better than what it used to be. There are now vaccines which prevents hepatitis B and therefore hepatocellular carcinoma. There is a vaccine like cervical cancer vaccine which prevents a large number of patients to get cervical cancer. And to develop a cervical cancer in a Western country is a failure of a preventive program, which is program. So if there is a cancer which happened in a cervical cancer, they go back, why did the patient develop it, why didn't the patient get pap smear, and why didn't the patient get vaccine, and they take it as a very serious event. So these are the 9 warning signs: change in bowel, bladder, sore, unusual bleeding, discharge, lump anywhere, difficult to swallow, change in a mole which is common, a persistent cough, a cough which just doesn't go away, anemia, weight loss. And just to give you an example of how many famous personalities like Madhubala, Manisha Koirala, Lisa Ray, Anurag Kashyap recently in problem. This is the guy who found Apple. So these are the people who went on to have cancer, and some of them actually died from cancer, including the guy who could own half, 1/4 of a country, perhaps our GDP, still died. So Babu Mushahi zindagi badi honi chahiye, lambi nahi. Manisha Koirala has done very well. She was picked up as pretty late stage of ovarian carcinoma, stage 3C, and she has done very well, and it's been about 5 to 6 years now, surviving very well. Lot of changes that happen in surgery. No longer such surgeries happen. You can't identify which is, I think the surgeon can only identify which has been the operated breast. Such nice surgeries are possible. They don't open up the whole tummy now or the whole area. They can go keyhole. They can do limb salvage. Difficult to identify in this picture which limb is operated, obviously until you see over here. You can rehabilitate the voice. People can speak after removal of larynx. There are new and new technologies happening. Radiation therapy is becoming very, very precise. So you treat only the tumor and you don't treat anything else. We have started to use immune therapy whereby we don't kill a lot of cancer cells, but we just stimulate the immunity of the body to go entirely against the cancer cell. This is a new drug or new armory in our this thing. Yuvraj Singh has done well from the last World Cup before we lost to his marriage about 6 months ago. He has done remarkably well. So cancer can happen to anyone. Prevention is better than cure. I think avoiding tobacco itself in one form or the other is one of the most important things. It is obviously not an occupational hazard, but it's a very important thing. There are many other things like regular exercises have a very strong index of suspicion. I think that is one thing which for a caregiver is extremely important. Think of cancer and then you'll be able to pick few early cancers and save lives. For a person, consult your doctors and don't have fear for cancer. We are a lot better than before. Thank you.